So the model is based on clinical characteristics being tumor size and age and type of tumor and where it is and how deep it's seated, histological types and grades, also treatments being either surgery and their margins, radiotherapy or chemo. But it doesn't include having diabetes or grade 4 pulmonary disease. So the application doesn't hold true for patients with severe other diseases because they may die for something else earlier than from their sarcoma. So this is something we need to have. So we need to have their performance score in the application, their other diseases, to make better survival estimates. And maybe even more important, and this is something that we are currently working on, is gathering enough quality of life data to actually tell a patient you have 5% less risk of having local recurrence, but your quality of life drops with 15% when you have radiotherapy. So, yes, local control is better. No, functional outcomes is worse. So then we can decide better, because now it's all based on prognosis, and it should, of course, also be based on how happy patients are after the treatments. And this holds true more so for elderly patients than for kids. Currently work more with kids, and their prognosis and outcome is first, second, and third, because survival is super important for all the kids and parents. And of course, they want to have their optimal quality of life and functional outcomes. But basing decisions on functional scores is a little bit more difficult. But it's more important when you're 76 or 86 and some surgeon is saying you have to lose your leg, or let's save the leg and have a little bit higher risk of local recurrence, which you can still walk. So there's always nuances, and I think that's where we need to go. So from a clinical point of view, and of course, we are using parameters that are disease proxies, so size and type of tumor. But of course, we need basic science to help with DNA or RNA profiles that may predict risks way better than just the sheer size of a tumor. So biological aggressiveness or activity is something we still don't know, and this is something we need to have in the new models. But this is something 10 years from now.